Anshul, Dr. Anshul, yeah.
Good evening, everyone. My topic is Magic of Perseverance, a dancing foreign body in the eyelid. An intraorbital foreign body is an object that lies within the orbit but outside the globe. Such foreign bodies are quite common in pediatric population since children are playful and they do not know the nature of objects in hand. Orbital foreign bodies may damage the intraorbital structures and lead to serious complications if not identified and removed in time. Organic foreign bodies can cause excessive inflammation and reaction and should be removed as soon as possible. Inorganic and metallic foreign bodies may remain inert for a long time, but they may cause fibrosis and migrate, leading to damage of major orbital structures. We present a unique case of graphite foreign body in the left upper eyelid of a 10-year-old male child. The child came to ophthalmology OPD complaining of something in his left upper eyelid which he could feel and move with his fingers. There was history of fight with a fellow student in school 5 months back, during which he was hit by a pencil. The visual acuity was 6 by 6 in both the eyes, ocular movements were full and free, slit lamp examination was unremarkable, and fundus examination was within normal limits. Initial examination by palpation could not reveal anything, but the child could maneuver the foreign body in the upper lid with his fingers to enable us palpation of a hard linear mass about half a centimeter, which was freely mobile subdermally. On careful examination, we could notice an entry site on the skin below left eyebrow with mild discoloration. And since the foreign body was superficial, an ultrasound B scan was done, which revealed a highly echogenic linear shadow measuring 4.4 mm in length in the preseptal subdermal fat in the left upper eyelid. So as we can see in the image, the first two, the image 1 and 2 look as good as normal. And in image 3, this is after the child maneuvered the foreign body, we can see that a little bump can be seen with mild discoloration. So based on these findings, the patient was taken up for foreign body removal under general anesthesia. Since the surgery was planned under general anesthesia, localizing the foreign body posed a challenge because we could no longer take help from the child. The child was asked to maneuver the foreign body in the lid, which was marked before the anesthesia was induced, and it was held by an assistant using an earbud. Aiming for least visible scar, a 7 mm incision below the eyebrow was made and the foreign body was dissected out neatly. As we can see in the video, a very small incision about 7 mm was given, and as soon as we gave the incision, the foreign body was lying, which was neatly dissected out. Foreign body as measured after removal was roughly 6 mm in length. So in this case, timely removal of foreign body was essential because it threatened damage to neighboring orbital structures, the LPS aponeurosis or Muller muscle, which could have led to ptosis. Furthermore, there were always chances of granuloma formation and recurrent infections could have occurred. The ophthalmologist should have sound knowledge of how to locate the foreign body, and a rational decision should be made on removal technique along with minimizing the radiation damage due to various imaging modalities. To conclude, intraorbital foreign bodies in pediatric population can have sight-threatening effects, so a meticulous history along with proper management is always necessary. Thank you.
So finally, what was the foreign body? Pencil?
Yes, ma'am. Graphite foreign body. I can, this image,
It was the
it was the tip of the pencil, and it was freely floating in the eyelid.
Yeah, well, that was well managed. When it's anterior, it's much easier.
Yes, ma'am.
To do that in the depth is always difficult. So how often do lead foreign bodies, I mean, is there a, how reactive are they if it was deep in the orbit?
Usually they are inert only because lead is an inert substance. But yeah, given that it is a sharp object and it was freely mobile in the eyelid and the child could maneuver it again and again, it could have definitely caused damage.
It was anterior, so taking it out wasn't very hard. So.
Yes, ma'am.
Okay, thank you very much.
The only challenge was that it was freely mobile, so the child was under anesthesia, so we had to really hold it in place so that it doesn't get lost.
Yes, so such cases MRI cannot be done because suspicion of any
yes, ma'am.
iron foreign body or something.
Yeah. Thank you so much.